the long-term health crisis of eating disorders. A decade of increased risk eating disorders are not short-term illnesses. They impose a sustained and significantly elevated risk of severe health complications and premature death for years, even decades, after diagnosis. A large-scale study from the University of Manchester, published in BMJ Medicine, reveals that individuals with anorexia nervosa, bulimia, or binge eating disorder face a dramatically increased likelihood of organ failure, chronic disease, and unnatural death compared to the general population. Decades of elevated mortality researchers analyzed the electronic health records of over 24,700 individuals diagnosed with an eating disorder, alongside a matched control group of nearly 500,000 people without such a diagnosis. The findings are stark. Within the first year after diagnosis, the risk of death from any cause is more than 4 times higher for those with an eating disorder. This is driven largely by unnatural deaths, suicide, overdose, accidents, and homicide, which occur at 5 times the rate of the control group. The alarming trend doesn't diminish with time. Even after 5 years, eating disorder patients continue to experience a higher mortality rate, an additional 43 deaths per 10,000 individuals. By 10 years, this rises to 95 excess deaths per 10,000 and a shocking 341 unnatural deaths per 100,000. The study confirms that eating disorders aren't just a mental health issue. They are a long-term threat to physical survival. Beyond death, organ failure, and chronic disease, the long-term impact extends far beyond mortality. Within the first year, eating disorder patients are 6 times more likely to develop kidney failure and nearly 7 times more prone to liver disease. These risks remain elevated even a decade later, highlighting the lasting damage inflicted on vital organs. The heightened risk of suicide is particularly disturbing. Individuals with an eating disorder are nearly 14 times more likely to die by suicide in their first year post-diagnosis, and even after 10 years, their risk remains 3 times higher than the general population. This underscores the critical need for sustained mental health support alongside medical care. Why these findings matter: the study challenges the misconception that eating disorders are temporary illnesses. The data demonstrate that these conditions trigger a cascade of long-term health consequences, including organ failure, chronic disease, and premature death. This underscores the importance of early intervention, comprehensive care, and ongoing monitoring for individuals with eating disorders. Researchers emphasize that healthcare providers must be aware of the lasting effects of these conditions and provide sustained support for symptom management and recovery. The findings serve as a stark reminder that eating disorders are not just a mental health crisis. They are a chronic health threat with potentially fatal consequences. The research reinforces the need for systemic change in how eating disorders are understood and treated. Early intervention, continuous monitoring, and comprehensive care are essential to mitigating the long-term physical and psychological harm these conditions inflict.